The virus of fear is how Professor Haque describes Ebola. During the 2014 outbreak, he treated several Ebola patients. Patient 0 was a child infected near a hollow tree in southern Guinea where bats nested. That's when scientists believe the virus jumped from the bats to humans and spread to 28,000 people across West Africa. More than 11,000 people died of the virus in what was the deadliest Ebola outbreak in history. But Senegal recorded only one case treated by Dr. Ka. He says in any Ebola outbreak, Haque is the virus's greatest ally.
When people panic, they expose themselves to even more risk. When there's panic in health centres, that leads to bad decisions and dangerous behaviour.
It took Guinea 3 months to notify the World Health Organization of the outbreak and several more months before the WHO declared it an international health emergency. Touslo says this MSF doctor who was on the ground fighting Ebola. For him, the lesson is clear. With Ebola, early detection is key.
Par conséquent, il faut la confiance.
You need trust and cooperation from local communities. They have to be involved. They have to understand the virus. That is the only way to stop it early. And contact tracing has to be rigorous, because if you don't find those contacts quickly, the outbreak spreads in every direction and becomes much harder to control.
But detection was not enough. Borders were shut, armed security patrolled the streets enforcing quarantine measures. As the death toll increased, so did mistrust. Health centers were placed not to heal, but to die.
Pendant la même période que va durer l'Ebola en Ituri,
What worries me deeply is that during the same period as this Ebola outbreak in Ituri, far more children will die from malnutrition, malaria and measles than from Ebola itself.
It took 2.5 years before people celebrated the end of the epidemic, unaware that the virus was still lurking and a new outbreak was to come. Nicolas, Haque, Al Jazeera, Dakar.